Disparities research, the co-lead on the Community Engagement and Dissemination Core with Jennifer Syvertson. And my own project is, I'm the PI for the Chihun Piyong Inach Gathering of Good Minds project, which is a collaboration with our tribes and Riverside San Bernardino Indian Health right up the freeway from campus. And that is a full community engaged research project. And joining me today is Professor Ann Cheney. So Ann, did you want to introduce yourself?
Sure, thanks Juliet. Hi, my name is Ann. I am assistant professor in the School of Medicine, the Department of Social Medicine, Population Public Health. I am part of the U54 and National Institutes of Health grant, and I am the PI along with Tanya Neary of the Grow Well Project, or Crecer Bien. I also am PI of 2 PCORI awards. This is Patient-Centered Outcomes Research Institute. One is Voicing Collegiate Recovery, and the other is the MyPlate Project. I'm also the director of Hablamos, which is a 4-year longitudinal program for medical Spanish in the School of Medicine. And then you also may have received emails from me about Healthy Campus. I'm the co-chair for Healthy Campus.
Yeah.
Thank you.
Yeah, so thank you, Ann. And so a lot of the work that we do individually and with the center is really focused on how to bring communities into the research process and how to help faculty learn more about what it means to do a community engaged research. So as I shared the agenda, first we're going to share the premises of community engagement. And I should say community engagement research, because a lot of people do community engagement, but the research piece is what we're really interested in focusing on. And then incorporating that into your proposals and then having time for Q&A. So some of the basic ideas around community engaged research are to really build trust with our partners. And, before we've talked about, there's this sense of research fatigue where communities are always asked to participate in research, and then they never get any information back from the research that was done. So they've answered all these questions. They were excited because they know that the researcher was trying to address a need in their community, and then they never get to find out what happened. So that leads to a lot of research fatigue. It also leads to a lot of lack of trust with the university and with researchers. So if they're going to invest a lot of time, we need to make sure that we're always thinking about how we're building relationships with our community partners. Everything that we need, that we're doing, is part of that relationship. The other strength of doing community engaged research is thinking around how the partners come together to help show us what is actually relevant for their community. What are the needs, is particularly around health disparities, and how do things work, so that when the research is done, the findings and the outcomes and the way that we disseminate back to the community as well as up to policymakers is relevant to actually what they needed and their goals. There's nothing worse than having research done and it doesn't apply to the community at all, right? So we want to always think about that. And that requires a different way of thinking about how we're doing our research, right? Community partners are our collaborators. They're not just subjects of a research, but they are full partners in everything that we do. So when we think about community engaged research, there's all these assumptions and ideas and philosophies around actually what's going on. And so it very much is a field in and of itself, with a whole literature about theories, a whole literature around methodologies and how to do these things. In the literature, one of the key ways that people often talk about community engaged research is community-based participatory research. So a lot of times you'll see CBPR. And so they're talking around some of the same aspects that we're talking about today. So community engaged research would be the umbrella, and community-based participatory research would be one of the methodologies within that. And that CBPR emphasizes equal partnership to create change, right, with our community partners and for us to improve health. And so oftentimes CBPR is focused on a specific geographical area with people who have relationships with each other, have different shared perspectives on a particular topic. So for instance, my project is in Riverside, San Bernardino with the tribes. And after long conversations, we were very interested in thinking around historical trauma and what that meant for the community members, as well as the physicians who provide services to them. And so we started this conversation about what could we do? What might that look like? And throughout the whole project, every single step of the way, we've had 2 grants in this project, and they have always been equal partners in designing the project, deciding what kinds of questions should be asked, who we should talk to, how we enter into the community, and then how the work would be disseminated. So for us, we launched a whole series of podcasts, and that was from the community. That's what they decided. And part of that reason was because they were thinking about physicians who are driving from clinic to clinic, and the best time for them to learn about their community was through listening to the podcasts as they were driving from each clinic, right? So every piece of what we did was a shared decision-making process. And, you know, some of that comes through our community advisory boards. And as it says, collaboratively disseminating our research findings. Together, we decided the whole way this project should look. Anne, did you want to add?
Yeah, so what I will add, in addition to what Juliet is just mentioned about the co-creation of knowledge, it's also the idea of resource sharing. So thinking about what resources may go to the community and how the knowledge and data that are collected, how it can benefit the community. Again, moving toward this idea of creating social change. So very much when we think about the partnership, it's the decision-making in various aspects of the process of thinking about the data, who owns the data, for instance. It no longer is exclusively the ownership, for instance, of the investigator. These ideas are co-created, and it's really important to think about those kinds of things.
So if you've been to some of our other events, you've seen this slide before, but we think it's critically important to sort of talk through that. Anne, did you want to?
Sure. So I think I've presented on this slide like, I don't know, 50 times. This slide, I think, is really important because it talks about the various ways that you can go about doing community-based work. And as Juliet mentioned earlier, CBPR is just one way of engaging community in the process of collecting, analyzing data, thinking about the research. So I want to walk through this arrow and think about what does it mean when we talk about this idea of more intensive community engagement versus less intensive or medium levels of engagement. And I'll use some of my own projects to illustrate some examples. So when we think about more intensive work, this is really when our community partners, we collectively as a team, are collaborating fully in all aspects of the research. So this is from defining the study question, designing the methods, implementation, analyzing the findings, and disseminating the results. Right now I have a project ongoing in the Eastern Coachella Valley that focuses, it's called My Plate, and it focuses on the dissemination of evidence-based nutrition education to reduce hypertension, but also to really help individuals who are pre-diabetic or who have diabetes to control their sugar levels, essentially. And so we started to come up with this or move toward this idea because of initial research findings where we found that diabetes and obesity were concerns and needs among the communities in the Eastern Coachella Valley. So this is out about an hour and a half from here in more rural areas with primarily Latino community members. And what we did is we had this information and we decided that we wanted to move forward with it, but we didn't exactly know what we should do. And so what we did is we set up meetings with a healthcare system and we shared our findings with them. And then we talked about what could we actually do with something like, with the information that we have, what kind of partnership could we build? And then how could we move forward with designing a study? And so when I say we, I'm talking about a network of promotoras that I've been working with for a number of years, who also helped collect the data and analyze the data. So they had been involved from the get-go and thinking about the meaning and significance of this information. And so we collectively came together and we talked about what would a study look like. And while I was primarily the individual who took those ideas that we generated collectively, the promotoras, the providers within the healthcare system, and the patients, I wrote it up and I shared the information with them consistently and getting their feedback. So this very iterative process. And now we received funding and we are implementing the project itself. And individuals who have been partnering with me for some time, we've been partnering together, now have developed capacity to be able to collect the data as well as analyze the data. And so one of the promotoras, she is the community partner and she will be leading the data collection and analysis specifically with patients who utilize the MyPlate recipes. So, you know, it's a little bit more complex. But to illustrate that this is an example of really intensive collaboration. When we think about medium collaboration, I think about the project that I have as part of the U54, which is project 2 of our center grant that is around childhood obesity. And we are partnering with 4 different counties, early Head Start programs in Southern California. And very much the partners, the administrators within these 4 programs were instrumental in thinking about how would we work with their organizations to be able to recruit participants into our study, and then also to collect and analyze data. And while they are instrumental in creating access and supporting the project, and some of the employees, staff members within their organizations are helping to recruit, their participation is limited, you could say, in comparison to the first example that I provided. We have a community advisory board, we have diverse stakeholders who oversee our project, ensuring that we meet the specific aims of the project over the 5 years. And then when I think about less intensive, so an example, assisting in performing discrete steps in a research or design study, such as recruiting participants. So not exactly here, but in my previous position, this is a lot of the kind of work that we did. We would hire research assistants, for instance, who would set up study offices, essentially in communities where we would be collecting data, and we would have these individuals find key informants or individuals in the community who could help us recruit participants into the study. But in this type of work that we were doing, we weren't including the community from the get-go and thinking about what would the research look like. We also weren't thinking about necessarily how might this research benefit the community immediately. And so it was a little bit more distance in comparison to the other approaches where it's much more community driven and involving the community in various steps along the research process. Do you want to add anything, Juliet?
And mute myself. That was great. Thank you for sharing that. It's always amazing to see, you know, the range of things that people can do with their community engaged projects. And so, you know, I love the details that you gave through each of those pieces, from the most intensive to least intensive. And I do have to share, like, the 2 projects that Anne and I have been doing, well, they have a lot of funding, you know, so at minimum it has $250,000 of funding for a couple years, but it can go up from there. So we wanted to share with you the range of opportunities, because as we think about the pilot projects that you would be applying for through the center, we want to make sure that you know, our expectations are realistic in terms of what can actually be done. So there's, of course, all the things that we shared with you that could be done, and thinking about, you know, how we want to do this. Again, building shared conversations around research goals. But you maybe want to, for the pilot project, only think about one or two aspects of community engaged research. And I would say that really, you know, thinking around community advisory boards is one of the key ways, and we'll talk a little bit more about that, because there's so much that you can do by engaging that in that conversation with people. And the other reason, you know, to think about one or two is, what is your capacity? One or two pieces, what is your capacity to do the work in the pilot project timeframe? But also, a friend was sharing with me the other day who reviews a number of NIH proposals. And he said, you know, usually I go through the specific aims and kind of get a sense of what's going on. And then he said he goes straight to the budget to find out what's going on there. And it's through looking at the budget that he can tell whether or not the person actually knows what they're doing. And so if your budget doesn't reflect an actual community engaged process or even components of it, then it raises questions like, oh, well, do you really know what you're doing with community engaged research? You know, so how should that look? So thinking around budgets, and particularly for our proposals, if you're having a CAB, make sure you're thinking about how are you going to pay the CAB members. If you're having community members work on the interviews with you, how are you going to pay them? Food, we always talk about, you know, you can't show up, you can't ask people to gather, although this moment has changed things a little bit. But asking people to gather, community to gather without having food and sharing, you know, a sign that you're caring for people and building a relationship with them, you know, needs to be in the budget, is something that we're going to do. And then travel for your CAB members, you know, sometimes, especially because we're in such a large geographical area, are coming from all parts of Riverside. So, you know, how are we going to take care of those needs for CAB members? So thinking about, you know, how your budget goes along with what you say that you're going to do in terms of building these research relationships is critical. Did you want to add anything, Anne? So we kind of broke this down into two areas that you can think about putting into your proposals. One, as we said, is the community advisory board. Really, the community advisory boards are so critical. They're people who can give you guidance on the project as a whole. They can connect you with other community members. You know, who are the experts? Who are the people that the community members who really have that shared interest and want to see the kind of health change, addressing of health disparities in your community. So community advisory boards actually can help you do the whole range of community engaged research. So, you know, support in developing the research questions, recruiting participants, data collection, analysis. And oftentimes people hesitate on the analysis piece because, you know, we think that to do the analysis, you need to have all sorts of expertise in specific statistical analyses or lab analyses, and, you know, and that is true. But we want to think about, how do we build capacity? How can we train people to do parts of it for primary data collection? Maybe they can go look at the survey that you're asking questions of. Same with secondary, because a lot of people apply just for secondary data analysis. And so community partners can look through the survey and say, well, these questions work, these questions don't make sense, you know, and help even interpret what's going on in the data. given the opportunity and collaboration and understanding what the project is about. And then of course the dissemination aspect, at minimum, you know, they need to be part of, community needs to be part of disseminating the data. So having them part of the advisory board and sharing what the dissemination process should look like, who should it go out to, who are the policymakers that should be having access to your findings, to your group's findings. These are all critical pieces. So picking though, for a pilot project, you want to pick, you know, 1 or 2 pieces. Anne, did you want to?
Yeah, I'll just add about the dissemination piece in particular. When we often think about this through the lens of the academy, we think of publications that we might submit to peer-reviewed journals. And it's really important that we shift our thinking to consider, certainly that may be important for generation of knowledge, but to a particular community. But we also need to think about what's most meaningful to the communities that we're partnering with. So figuring out ways that are not just peer-reviewed publications to disseminate information is really important. Some ways are social media or radio interviews or television, just different creative ways to be able to disseminate information. And community often has, you know, really great insights into what is the best method or avenue that's going to work and resonate with their community.
Mm-hmm. Yeah. Yeah, that's like the dissemination with our podcasts. That's the way the community wanted it disseminated, which was a fascinating process, learning curve on how to do that. But also now we have the whole basis for writing papers together. And I do always publish with my community partners. So, you know, it can meet all of our needs.
And one thing I want to add is, Juliet, that's a good example of how the idea of capacity building and community-based participatory research or community-based research, that it's not just one way, it's bidirectional. So we as investigators, as academics, we learn as well. We learn new skills and new ways of doing research based on what the community is able to teach us.
Yeah, absolutely. I just have to add to that, right? This has been one of the most joyful experiences doing more community engaged work through all of the steps. You learn so much, and the research relationships and personal relationships that you build are just amazing. It makes us more creative people.
Mm-hmm.
So as you're thinking about which pieces, you always want to make sure that you're answering those basic questions: who, what, when, where, how, in your proposal. So, you know, who are the people that are going to be part of, say you're proposing that you're going to set up an advisory board. Who are the people of interest, you know? And so kind of having an idea, you know, are they just individuals who have a shared interest from the neighborhood? Are they health activists? You know, are they CBO leaders, community-based organization leaders? Who are the people that you want to have as part of the advisory board? And that means that you're having conversations with community partners and other people who are already working on these issues, and they will share with you like who should be the people on the board. You don't need to just come up with that by yourself. It is a collaborative process. And then thinking about how you will, or what you'll do. So what are the things that you'll do to build trust with the community? Are you going to share the proposal with them and get their advice on how to adjust it? Are you going to share the IRB? Are you going to share budgets, right? And other expectations of what's going on. Did you want to add to that, Anne?
Yeah, so I think just this point of what do you expect of each other? So this ties back to this idea of, you know, like co-sharing, co-decision making, co-learning. What are the responsibilities and expectations that you may have for members of the advisory board, but also that they should have of you as one of the investigators leading the project. That's really important to think about, that it is very much this collaborative process. You should always have that at the front of your mind when you're thinking about the activities that you are engaging in and that you ask others to engage in.
So, and then thinking about how often are you going to meet? Where will the meetings be held? You know, you can't always have everything at the university. It's good to bring people to the campus because people want to know what goes on here. Again, that co-learning. But you also have to have meetings in the community. Most of our meetings take place in the community, and then when people want to come to campus, then we invite them here. And then how are you going to think about implementing their recommendations? Like, how do you have those conversations about what the question is, how you and your advisory board might want to do things? And along with the building of trust, you know, how will people receive credit for the contributions that they make? Will they be compensated for their time? You know, what are these kinds of questions? And all of these pieces are part of the proposal and the discussion of the research. For me, I actually share my PCORI proposals. They're on my personal website. I can give you the link for that because I think everyone needs to know how to write these proposals. It's a different kind of way of writing. And the more that we share, the more resources that we provide for each other, the better we will be at doing these kinds of things. So these are questions: who, what, when, where, how, all need to be part of the proposal.
I do just want to add that this is really time-consuming work, and so also be really mindful of that. It's time-consuming for all members of the research team, as well as for the participants that you engage in the advisory board, for example, or other aspects of the research. There's also something else, but I have forgotten it.
Yeah.
If it comes to mind, I'll share.
Well,
oh yeah, this is it. So keep in mind, this is Health Disparities. We are a Center for Health Disparities Research, and you are proposing to work with health disparity populations. And so really keep that in mind when you're thinking about expectations of what you may or may not have. I know someone just mentioned in the chat, it's best to go into the community. That's a recommendation. And yes, like thinking about, some people may not have access to, for instance, public transportation or their own personal transportation. And so that could really make it challenging for them to get to certain places. So keep being mindful of those things is really important.
Yeah, absolutely. I love the chat too. I was sort of glancing at that because I know that there are a few community members who have done a lot of research with UCR in this gathering. And so, and I love the sharing that's going on there. So thank you, Jeff. And I saw Jorge's here, John Epps. Like, there are a lot of people here that have a lot of experience and knowledge that we can draw on as well. So there's community advisory boards, and then capacity building is another way to think about engaging the community. So research design, did you want to talk about that, Anne?
Sure. So you can actually, I think Jeff made a comment on this, that it's really important to think about including community in the process of developing the research. And one of the things that we're doing for my Voicing Collegiate Recovery project is we have a whole 1.5 years dedicated to capacity building. And we are engaging diverse stakeholders along the way who are instrumental in helping us understand the needs of the community as well as the priority areas. And we, in the end, will identify individuals who will be able to use the data that we've collected, that we're collecting right now through forums, community forums on, so this is a project on recovery, student recovery from alcohol and other drug use. And we will be providing those individuals who have been engaged along the process and involved with our team not necessarily as team members, but as individuals who are interested and invested and who have built their capacity over time in collaboration through this project. Those individuals will be actually designing through a research work group the next step for our research and our study. So this is an example of how it's a very long process, it's very iterative, but there are ways that individuals who may not have the same kinds of background in research design can also be instrumental in the development of research.
Yeah, the earlier community is integrated into the project, the better, that's a great example, Anne, of how to build that capacity to see what happens in the end in the long run. So data collection is another way people often talk about building capacity with communities. Sometimes people have already incorporated that into their projects and, you know, with a little bit more explanation, didn't realize that this actually is a community engagement process in terms of capacity building. So how are we training community members to participate in the data collection? So just last week, Jennifer Syvertson and I held a qualitative interview training gathering for our interns who, you know, want to be part of collecting data. And so this is something that the center will be doing as a whole, you know, to provide these kinds of training so that you can do the work, your community partners can do the work. So will you be training them? What might that look like? What data will you have them collect? And then again, will they assist in data analysis and interpretation? You know, what's going on, that local level knowledge about how to think about and look at the data is critical. You could also have them working on data cleaning and other pieces that are all parts of providing the skills for really being equal partners at all levels in the research process.
Okay, so this is me. So Juliet asked that I talk a bit about what it's like to actually work with other academics on community engaged research projects. And so currently I'm working on David Lowe's project, of which he's the PI that is part of the center. It's Project One, which is focused on childhood asthma. And it's interdisciplinary, and it brings together, in our case, laboratory science, public health research, and statistical modeling. So it's been a really interesting experience, and I think also really rewarding, and I've learned a lot. What I've learned is that it's really important to consider the cultural differences that might exist within team dynamics. So I am an anthropologist, and my position is within the School of Medicine. And for years, I've been working on interdisciplinary teams, often as the lone anthropologist. And I often am valued for the methods that I can bring, for the perspectives and the theories. And I also very much depend on others who are on the team to bring statistical methods or their own theories and insights and frameworks from their disciplines. This is actually the first time for me that I've been working with laboratory scientists. And there are different ways of thinking about how you create knowledge and evidence. And those are largely, I would say, differences that we learn as we are enculturated into our disciplines in graduate school, through the process of professional development. And no one theory or tradition or philosophy is better than the other. I think this is what makes interdisciplinary work so rich, is that we have the opportunity to share and to learn from each other. But it's really important in the process that you recognize that there will be differences, that there's differing ways of understanding phenomena. There's different ways of asking research questions. I'm primarily a qualitative, well, I consider myself a qualitative expert. I do mixed methods research. We don't use hypotheses typically in qualitative research, but in statistically driven or survey driven research, for instance, you would be hypotheses testing. And that's a different way of asking questions in research. We also have to think about the valuation of different methodologies and approaches. No one method is better than the other. There are many different methods, and we need to consider what's the most appropriate method to answer the research question. And then also be mindful that you bring your own language and jargon to the table. So I know I worked in the VA for a number of years, and everything was acronyms. And it took me a good 6 months to figure out how to communicate with members of the team because I didn't understand the jargon. I didn't understand the acronyms. So it's really important that there is a language of communication, a way for people to communicate, and also just openness to understanding that you have been steeped in different traditions, and valuing that you are there in a team together, that others, especially if it's funded research, others have seen what the possibilities can be, and to build that communication and expectations collectively together.
Sorry, that was a lot in 25 minutes. So we are here to help you, to support working through these really exciting opportunities to do community engaged research. The Community Engagement and Dissemination course, so CEDC, since we're speaking of acronyms, we have community engagement studios. You can look on our website to apply for one, where if you have a project that you're thinking about, you give us a brief of the proposal, and then we bring together experts from the community in that area. So we have our own community advisory board who helps us bring together these people, and that the community members that will help us, figure out how to advise you on all levels or just one level of your project, depending on what the needs are. We can also help you build your community advisory board, as well as attend first meetings to just sort of, support the process between this relationship building. We can also assist in training researchers in community engaged research, our partners, and then dissemination as well. So there's all sorts of ways that the community engagement core can support. And we will also be sending you materials. So everyone who signed up, some articles, you'll have access to the slides, and other resources on community engaged research. And then finally, we have our BFF. Because we're relationship building, we'll go with best friends forever today. But it's also a big, feasible, and fundable group. So I know there's a few people here who have been to some of the meetings already. It's the second Wednesday of every month, and it really is community building around research. So please join us at that effort as well. So we don't want to just throw all this stuff at you and say, okay, go do it, because it is, both Ann and I have had years of experience doing this kind of work. So we want to help support you in doing that and make it easier. And, as you can tell, our community partners are very active on our chat and helping answer questions live. So thank you. Thank you to have more training sessions like this. So maybe we'll just have our community partners do the next one, and they can
That's a good
share
idea.
all of their knowledge. So questions? Or did Jeff answer them all?
Well, maybe it's a good opportunity. Jeff, do you want to share anything about your experiences on the projects that you've collaborated on?
Sure. I'm just entering a resource from AVAC, the AIDS Vaccine Advocacy Coalition, which is, can you imagine when you do vaccine trials, HIV prevention trials in resource-limited settings, getting the community involved and engaged is crucially important. And there's some tragic examples of millions of dollars wasted on studies that didn't work because they didn't do that homework. They have something called Good Participatory Practices, and I just put that in the chat if people want to check that out. But yeah, and I think the most important thing, and I'm glad you mentioned this, and I think you need to stress it more when you're speaking to academic audiences, is you start at the very beginning with you don't come with a defined research question. You say, this is something we think may be a problem. What do you think? What are the most important things to you? And it may take things in a completely different direction. You may have to get people outside your discipline involved, but it's really important to go to the community and find out what their issues are, because that's the best way to engage them. If you're addressing, if they agree that what you're addressing is an important problem.
Yeah, so that's an excellent point. And Jeff, I just want to build on that. So an example, I used to think of myself as having expertise in mental health and substance use, and now I think of myself as having expertise in an approach, which is CDPR. An example recently of the diversity of work that I do. So I currently am working with, as I mentioned, Dr. David Lowe, on his project one of this center grant. And it's, I refer to it as the asthma, I always think asthma infantil because we are always doing it in Spanish, the childhood asthma project. I do not consider myself, or at least prior to this, to have expertise in childhood asthma. But one of the first projects that I was involved in with promotoras, we learned that child health conditions were the priority in the community, and then obesity and childhood asthma were two of the main priorities. And I'm not exactly quite sure how I connected to David, but I knew that I didn't know anything about childhood asthma or asthma, but that David did. And so I was able to connect to him, and we began to work together. And this is a perfect example of where things shifted. I focused on, well, I can't do that because I don't have the expertise. I found other individuals who had the expertise. I had the expertise in something different, which was the engagement.
Yeah. And so much of this work is just collaboration and sharing resources, sharing knowledge, sharing what we know, is going on in the communities, and our expertise and their expertise and the other science expertise. And so it all, comes together to really make a much more robust kind of response to health disparities, because everyone's been included.
Monica has her hand raised.
Hi, Monica.
Hi. I love everything you're saying, and it always makes so much sense until me, a lab rat, that was why my picture was a lab rat, before things, tries to go out and actually do it. Theory, totally buy in. It's obvious as theory. Now I decide, how do I connect with community? I may say, oh, look, I sat next to Jeff Taylor at dinner. He must be the best person to do this. How do I know that? How do I get started? How do I figure out how to engage? Because I think Jeff is, as you can see by all his comments, he is the best person. But what if I didn't sit next to him at dinner? I was sit next to somebody else. How do I know who that is? How do I even engage, let's say, Jeff, so that if he's not the right person for this, I know how to get him to help me? It's just very pragmatic. I think those of us who are lab rats, we're not socialized the same way as you guys. We need a little more breadcrumbs to figure out how to do the beautiful theory you're saying. Mm-hmm. Or at least I do.
So Juliet, I'll take the first stab. So Monica, I think about it very much like, how would you go about finding someone who you would want to collaborate on one of your proposals? So an expert in the field, an academic. You would probably work through your professional network. So very similarly, how I was able to connect, for instance, to grassroots individuals in the Eastern Coachella Valley was one, when I first got here, I just asked people in the School of Medicine, who do you know in the Eastern Valley that is not an academic that I could go and just meet with, just to get a sense of, who could they connect me to? And so over about a year and a half, I was able to connect to different individuals, and then finally be able to connect to really individuals that I really wanted to collaborate with in terms of getting the grassroots perspective. But I think so much of it is about relationship building and networks, and going to people who you think might be able to redirect you to someone else.
Yeah, that's exactly what I would say. And just to add to that, when you're working with community, like everyone knows each other. I've gone to Jeff before for things, and so he tells me to go over and talk to that other person. You know, the amount of sharing of resources, because we know that there's so few resources out there that we need to share. We need to share all of our information, everything that's going on. And so, you know, the community partners have been amazing in sharing, you know, who's out there and who I should go to, you know, so maybe they're not the right person, but they know who the right person is. And so those networks, just the way, as Anne said, the way we build our scientific networks, it's the same process. Jeff, did you want to add?
Yeah, I mean, in terms of when you go in someplace you've never been before and you don't have those connections, go to the frontline providers. If it's a medical question, go to the clinics and ask the nurses who are on the front lines, not the doctor, because they're overwhelmed. The people talking to the patients one-on-one, community-based organizations and stuff like that. And they love when people want to collaborate and help them in some way. So if they don't know, they'll direct you to the people who do. So it just takes time and patience and kind of shoe leather activism on the ground to you know, take people out to lunch, things like that, find out what makes them tick, and then go from there.
So I just would like to offer, and I don't, since I have not yet done this, but I can offer an analogy to just try to translate it to my world. For those of us who've done collaborations with biotechs and big pharma, I will usually know people for 5 years before I get a really good collaboration going. But by the time I've been meeting them off and on, we have found a project that we're going to do, or they've come to me because we've been talking about stuff and they think I'm the right person to do it. But it's, I think what I hear is patience, and it takes time to develop these things, and a lot of us don't build in enough of that time.
Yeah, it's really time-consuming work. But I think yes, it's time consuming, but we're asking questions that are meaningful, not to us, which is, I think, you know, I'm going to be critical for a moment, but often when we think about traditional ways of doing research, it's more research, it's very research. It's traditionally been very research driven. And this is a shift. You know, one of our, like Juliet and I have been funded by PCORI, which their motto is like, research done differently. So it's in collaboration with those who would most benefit from the research findings.
Yeah, and I would also add that, you know, this is part of the goal of the center, is to sort of help us come together, you know, and find people a little bit more quickly, connect with people, but the relationships do take time, you know. So you know, I talked with the tribes, and we went for a couple grants, you know, for 4 years before we even got the ones that, you know, we have now. So you know, it's been 8 years with this relationship, and so but you start somewhere, and they were ready to work with me and write grants from the get-go. It just took us a little bit more time to get what we wanted. And so the pilot projects, you know, are kind of that first step. It's the first step into it. So that's why I put the resources page back up, so that we can step into this together. Jeff, did you?
Sorry, I just wanted to address Michelle's question on the chat about how to engage communities of color whom are often fearful of participating in research. And that's really tough, and that's really where you need to take the time to build those relationships and build the trust. Because, and I think you need to sit down and acknowledge, you know, what's happened in the past, to talk about Tuskegee and Henrietta Lacks and things like that. And because often people don't know that history, but they distrust and they don't really know why, because that history is kind of embedded in their culture. So you really need to kind of address it head on And Henrietta Lacks is a great example, you know, and so is Tuskegee. I mean, things change dramatically after that, and say, we learned from that mistake and we don't do that anymore. But again, don't do helicopter research. You just don't say, I've got something and you're the population I want to do this in. It's like, what do you need? And it may end up that they don't collaborate with you. You may end up connecting them with somebody else. And, you know, like Monica was saying, that builds that relationship and that trust, most importantly. And so maybe, you know, later on you'll have opportunities, and it could take years. But yeah, it's hard work, and you really have to be very intentional. You go to them and don't invite them to a meeting, and you find ways to help them. You know, if there's other projects and so forth, or, you know, funding sources or something, it needs to be reciprocal.
Yeah. Well, that was one of the reasons that our native, the project that we started with historical trauma, that's what they wanted us to be able to talk about, to acknowledge those histories. So, you know, it's so critical that we start there.
Yeah,
so,
just,
go ahead.
wanted to comment on John's message in the chat, that also we need to be mindful that we as researchers have biases. So all around there are biases that exist, and it's important, as Jeff is saying, to openly talk about these things, the biases we bring to the table, as well as those that community may bring. And also the biases that community members may have about research and what research means. I mean, we come to the table with power and authority, and we've had the privilege of accessing resources, particularly when we think about engaging health disparity populations, that many individuals may not have had those same opportunities or points of access. And that's a really important thing to remember.
Yeah. Michelle, did you want to add anything to the conversation? Because it was a great question.
Yeah, I think we definitely need to come from a lens of respect, mutual respect. But definitely, I appreciate what Jeff said about no helicopter, you know, research, really trying to be intentional about understanding the cultural issues if you're going to engage community of colors, and really, you know, what do they want to see be the outcome, and not making assumptions. You know, we kind of go in, like Ann stated, with biases, that we think that this is the issue or this is the health priority, but really asking them what the health priority is, because oftentimes it may not be in alignment, and being able to discuss with them and talk about, you know, how we can come to a good, I guess, meeting place where we can make sure that we are giving back and we are not taking from. We are, at the end of the day, you know, helping them improve their health outcomes, or whatever it is we're engaging them as it relates to research. So starting out with respect, and really wanting to understand the cultural needs and issues at whatever community we're engaging.
I think it's important, Michelle touched upon this as well as others, that giving back, reciprocating, and that may not always be in the form of research. So the research findings may inform something in the future that could be different from research. I think what's important, and it goes back to one of the first slides, is CBPR is about engaging in a process of research to improve the health and well-being of community. And while one product of that will be data and an evidence base, that evidence base can then be used for advocacy purposes, or for programs, or for other uses.
Yeah, this is Jeff. Just one last thing that doesn't always happen is to make sure you close that circle when you're doing research with communities, and make sure you disseminate the research back to the people that gave it to you, basically. And as a thank you, I mean, often what we do is have, you know, dinner or some kind of event, and really break it down, and then really make the effort to not just publish it in an academic journal, you know, to further your own career, to make sure that gets into the press and feed that story, you know, to the broader media, so that it gets back to the communities where it, you know, and that can be done. You can put writing in lay language, getting their help to maybe co-write it with you and find places in their community. But you got to close that loop. Because you start, if you ask them what they want to know, then you have to tell them what you found out and how it can benefit them. And like Anne was saying, does that translate into, providing services and things like that?
Absolutely. And you guys also touched on this earlier when you're talking about disseminating it back into the community, asking them what's the best way to get the information out to the community at large. It may not be, like you said, in a journal. It may be in something where a local newspaper that, they know their community listens to and respects. What's being printed or stated in the medium that's effective for them, and that's going to really, like you said, enhance or give back to the community.
Mm-hmm.
Yeah. So thinking about all those pieces, there's a lot to grab hold of, but
I think you froze, Juliet.
Oh, keep on going then.
You're unfrozen.
Oh, okay. I seem to freeze at the end of these things. I like Jeff's idea of that circle, right? The beginning, the ending, the dissemination, bringing people in before we've decided what the question is. And like Michelle said, making sure that they're in conversation for what goes back out. And so, having all of these pieces and remembering that this is a relationship that we're building with people that will improve all of our lives is the goal in the end. So this was a great conversation, and thank you everyone for sharing. We will have more of these. We will send out resources to you via email. Catherine will do that, and then we'll have this recording on our YouTube channel. If you have any questions, feel free to contact myself or Anne or, anyone that you've heard from in this gathering. And we just really look forward to doing this work with you. Anything else? Anne, Jeff, Michelle?
No, thank you.
Yeah, thank you so
really
much.
excited.
Great.
One more thing, just we will be sending a survey if you guys have 5 minutes to complete it and give us feedback on future workshops that you would like to see or any suggestions. We appreciate it.
Great. Thank you, Catherine. Okay, have a beautiful day.
Thank you.
Bye all.
Thank you, everyone.
Yeah.
Bye.
Oh, hey, Kathy. Okay. I have to get on another call, so I'm going to leave as well.
Okay.
Okay.
Thank
Bye.
you.
Thanks, Catherine. Thanks, Juliet.